People accessing mental health services today face some challenges in getting the help that they need, but it's vastly improved today from what it used to be. And the Mental Health Foundation has been proud to be a catalyst in making that change.
The Mental Health Foundation has been a catalyst for change over the last year by way of funding programs like Access Open Minds, All In for Youth, and specific technologies like the RTMS.
RTMS is repetitive transcranial magnetic stimulation, which is a treatment that's a technology-based treatment for treatment-resistant depression. So we don't tend to use it for people who have depression as a first treatment. We tend to use it after people have already tried things like medication or therapy and haven't had an adequate response.
TMS came about after 11 years having been on antidepressants and talk therapy through the entire time. At first, some of the antidepressants helped, but the antidepressant waned, and then it becomes a very hit and miss process to find something that works.
RTMS works by using a machine to create a magnetic field that pulses, and those pulses activate nerves on the surface of the brain. So when we stimulate those nerves, we can treat the symptoms of depression.
TMS has changed my life for the better. It's kept me well for years, and I couldn't be more grateful. Having TMS more readily accessible here in Edmonton is going to let thousands of people improve their mental health. It's worked for me, and I know it's going to work for others.
Being a catalyst for change means a lot. It means challenging the status quo and doing things that have not either been done or things that would be difficult in terms of evolving the change. We know we can do better, and it starts with how we can deliver services. Access Open Mind is changing the way we deliver service to young people. When you come in, you have everything that you need: access to psychiatrists, access to mental health therapists, occupational therapist, peer support worker, group therapy, social worker, and access to the availability of you being sent to a specialized care. We're building a place where youth would want to visit.
Being a catalyst for change means bringing the right people together, and All In for Youth has really brought together a format where education and mental health can coexist together.
Did you meet your new student teacher? Yeah.
We are not only treating some of the current issues, some of the current trauma, but we're also being very proactive so that our students can succeed in the future. It is so important that we have mental health support here in school, and the reason why is we have these kids every single day. We see these needs, and when we can affect change and impact students right here at school, they can learn better, they can just be kids. I can just see a huge shift in our students' behavior, their happiness, school academic levels are rising, and I just feel like the kids feel supported, and the families feel supported, and the teachers. We were doing the job of many people, nurses, psychologists, social workers, and now we have a team that wholeheartedly supports us, and we can work together and provide those supports for our kids.
The Mental Health Foundation has a better future in mind, and what that means to us is continuing the progress that we've made, continuing having people talk about mental health openly, honestly, reducing the stigma, and continuing to raise the funds that we need to help further the programs, the services, and the technology that we've already funded to date.
Community involvement is extraordinarily important to us. By making a donation, by attending one of our events, and by volunteering with us, you're helping us to better the mental health of this community.
Together, we are stronger. Together, we dream bigger. Join us and join a community united, passionate, unstoppable. Together, we'll be a catalyst for change.